Have you ever been to a hospital that is understaffed and you wait forever for a doctor or a nurse to come into your room? According to authors Needleman Burhas, Matt Stewart, and Zilvinsky, increased caregiver workload and declining number of RNs threaten the quality of patient care and safety. My name is Zoe Durrell, and I'm here to persuade you why hospitals should be hiring more nurses. Hospitals need to be hiring more nurses in order to provide the best quality of care for all patients in the facility. With COVID-19 and the guidelines and regulations for it, nurses are being forced to take on new roles and more patients than they have in the past. If nurses are having to do more work, then the patients are going to need better care. And if there are not enough nurses in the area to take care of the patients, then the quality of work is going to be lowered and they will be giving subpar care to patients. With cases increasing and nurses being exposed to the virus, they need to be able to quarantine as well and have people to be able to take their shifts. Therefore, they need more nurses to take care of those shifts that are taken. Because all things are connected, if a nurse is giving poor care to patients, then it will take longer for patients to get better, and they can also see that patients are spending more money in the hospital. While this may seem good for the hospital, it will cause the patients to not return because of the financial issues, and they have to stay longer than they should because the care was so poor. They did a systematic review and found that a hospital must be staffing in areas that need the staff and laying off unessential workers that are costing the hospital money. That study was done by Jay Spetz, March 31st of 2020. COVID-19 has caused the nursing staff to need more training in certain areas than they had before. Nurses are also having to work longer hours with limited resources to the protective equipment that they need, and they are being asked to wear certain masks and protective gear that they're not being supplied with because of financial needs. Hospitals need new employees that are trained in certain areas that are being affected by the coronavirus. You can see that there are staffing issues now because of COVID-19 causing a spike in patients. You can see these in both of these, that their patient to nurse ratio has gone up because of how many patients they're seeing with COVID. There are certain cities that are in need of more nurses because of the population that they have. Cities like California have been found to have the greatest deficit of registered nurses. And then the staff of registerednursing.org has found that by 2030, it is projected that the United States as a whole will add almost 800,000 new registered nursing positions in order to handle the increased need for them. There are more patients in need of intensive care due to COVID-19 than there were to begin with, and the ICU needs for their nurses to have these extensive training. Because of hospitals needing more staff, they must be able to afford these new employees. Financially, if a hospital can afford to hire more nurses, they can increase their profitability and patient care overall. Financially, it costs more to staff nurses, and they should reduce nursing staff in order to increase profitability. That was found in a systematic review done for the SSRN Electric Journal. Nurses are expensive to staff, and they have determined that hospitals would gain more money if they reduce their nursing staff. However, they have also seen that nurses are one of the most important staff members in the hospital setting because they are responsible for the quality of patient care and the outcome of their patients. The authors have also found that the hospital will have better financial performance in competitive markets if the nursing staff is at a level that is efficient for that hospital. So they have to know that hospitals are facing financial uncertainty and have sought ways to reduce their nursing staff in a way to increase profitability. Hospitals need more nurses in order to provide the best quality care for their patients. So in order for the most effective hospitals, nurses need to be adding to their staff. This means that nurses will be able to provide the best quality of care to a single patient that comes through their door.